Margaret Sanger, born September 14, 1879, was a prominent sex educator, writer, and nurse considered to be one of the first pioneers in the realm of women's reproductive rights. The first president of Planned Parenthood, Sanger is credited with originating the term birth control and founding the contraception movement in the United States. Sanger's mother was a devoted Catholic who bore 11 children, although she was pregnant a total of 18 times. Following the 8th grade, Sanger spent 2 years at boarding school. During that time, she became interested in women's rights. While away at school, Sanger's mother became ill with cervical cancer, which Margaret would later attribute to her numerous pregnancies. Because of this, she returned home to care for her upon graduation. Despite her care, Sanger's mother died. Sanger became interested in nursing and, following her mother's untimely death, attended nursing school at New York's White Plains Hospital. She began practicing OB nursing after graduating in 1900. Sanger worked in some of the most indigent areas of New York, delivering babies and educating mothers on infant and self-care. Through her work, Sanger drew a correlation between poverty, uncontrolled fertility, rates of infant and maternal mortality, and deaths resulting from illegal botched abortions. Mothers were desperate to discuss contraception, but were unable to, as it was illegal at the time. This barrier steered Sanger toward the belief that it is every woman's right to prevent unwanted pregnancies. Sanger advocated that if a woman did not feel she had financial, physical, or mental stability, she should not be forced to reproduce. From that point on, her nursing role would center around birth control advocacy and reproductive education. After extensively researching contraception, Sanger made a 3-step plan. The first step would be to educate the public, then change laws, and finally create an organization. Sanger wrote and published numerous articles on the topic of contraception. She was arrested for mailing birth control advocacy materials in 1916, although the charges were dismissed. That same year in Brooklyn, she opened the country's first birth control clinic with the initial goal of serving poor immigrant women without reliable access to health care. Despite the closure of her clinic in 1917 and serving 30 days in jail for maintaining a public nuisance, Sanger published her first periodical, The Birth Control Review, that same year. In 1921, Sanger established the American Birth Control League, of which she was the president for 7 years. This organization was one of the parent organizations to what would eventually become the Planned Parenthood we know today. As Sanger continued her advocacy throughout the 1920s and 1930s, the birth control movement gained significant traction. Increasing public support for contraception, along with Sanger's legal appeals, led the federal courts to grant physicians legal protection to advise patients on methods of contraception. In 1936, physicians received the right to import and prescribe various forms of birth control to patients. Even after this historic victory, Sanger continued to advocate, educate, and seek avenues of providing affordable contraception for the underprivileged and underserved. Margaret Sanger went above and beyond her role as a nurse during her illustrious career. She defined her professional identity early on as the first advocate for the legalization of contraception in an era when such a concept was socially and legally reprehensible. In this respect, Sanger also boldly embodied the Dusson core values of leadership, contextual relevance, and care management. Additionally, her extensive work with friends, nurses, and doctors to pursue her cause and champion new contraception techniques tie her to the core values of collaboration and scholarship. Margaret Sanger changed the lives for millions of women, advancing their right to decide if and when to reproduce. Her devotion, uncompromising determination, and humanitarianism are what make her one of the most noteworthy nurses in history.